All right, hello, Dr. Crouch back, and we're going to talk about one of our first splints, and probably the first one you guys should learn. It's one of the easiest ones to do. It's called a sugar tong splint, T-O-N-G, tong. If you put an H in there, it means something completely different. Now, sugar tong splints are best for distal radius fractures, both bone forearm fractures, and any fracture on the wrist that's being displaced down here. They're one of the splints that you actually need to focus on doing a good mold. Typically, the most common fracture you're going to do them are for Colles fractures, which just, so as we were saying, this works best with Colles fractures. They displace dorsally. Smith fractures will go the other way, but the fractures of the distal radius are best splinted in this fashion. The splint will go like a sugar tong, so it actually makes a little arch like this. And lift up your arm real quick, bend. So you're gonna go right along here, keeping the arm in a neutral position to the MCP joints. I usually like to take a piece of web roll like this to measure. This gives you a nice accurate measurement at the length that you need. And you can just tear right across there, and so you know how to measure for the length that you need. The two materials that you can use, orthoglass and plaster, are both a little different in its placement. For orthoglass, you just take the length that you need. You're gonna put it across here, so you know how long you need. You can make a quick cut. And you essentially have a piece and you're ready to go. Now, orthoglass itself isn't going to require, just pick those up, over here. Isn't going to require anything to be put on the arm because it actually has a cotton sheath. But I like to wrap the arm in web roll or fluff prior to its placement. Go ahead and bring it up. So for the web roll, when you're placing it, try and roll it across like this, not over the top. This will allow you to get a nice cleaner placement. And when you go, just a tiny bit of pull or traction on it will make it lay a lot flatter. Do at least a 50% overlap for your bottom layer. So you should have at least 50% overlap with the underlying piece. And if you're using orthoglass, you actually don't need to do a very thick layer of it. If you want, you can optionally use a stocking net underneath to wrap over, but it's less important with the fiberglass to use a stockinette. And once again, this step is optional, but it's nice to have that extra layer of padding. And patients generally are grateful for it. You can tuck that in and bring it here. So as we were showing in your earlier video, there's two different ways to do the orthoglass. You can just dip the whole thing, or you can take it and only wet the fiberglass. I always suggest only wetting the fiberglass. I've seen people just take a flush and squirt it inside, but the way I prefer to do it is when I open it up, I'll take it over to a sink or a bucket of pre-filled water. Buckets are often a little bit better because you can actually set the temperature to what you want. You take it, wring it out, get out that extra moisture, put it back inside and close it up. And now you have a nice rapid splint that's not too wet on the outside. This should dry in a matter of about 4 to 5 minutes. So you want to be a little bit quick with your next step. So when you place it, always have your supplies ready to go. You're gonna keep, don't worry about that. You're gonna keep the arm in a neutral position like so. You're gonna go right over the elbow and across to here. Then you can quickly unroll your ace bandage across to hold it into position. Now, as we said, orthoglass itself is not as good at holding reductions. So when we're using it, you want to kind of focus on just doing a nice, good, clean mold. And if you actually need to do a reduction for, let's say, a very displaced Colles fracture, you probably prefer to use plaster, and I'll go ahead and show you what the plaster looks like. You can use 2-inch to do a cleaner, prettier appearance at the top, or you can just use your scissors if they decide they're going to cut. Make a nice little cut for the thumb, like so, and wrap it up. Oops. Obviously, don't roll it up with your scissors in place. Tape, or reusing the little pieces of the little metal pieces that come with the ace can give you a nice clean closure. And if you're holding a reduction, remember that we said 3 points, so if the Colles fracture is broken like this, you're going to push in the opposite direction to hold it in place. If it was a Smith's fracture, you would do it the other way. Okay, stop. Now we'll let that dry, and while we're doing that, we'll do the real one, the difficult one. Somewhere. Okay, so plaster, as we said, was a little bit different, so let's show you the slight nuance difference of plaster. So we already measured for the length that we needed. We'll go ahead and set it down over here. So for plaster, it's very messy, so you want to make sure you have towels and everything that you need ahead of time. As you roll it out to length, you're going to roll it, fold it over, take it back, and roll it again. And you want to do at least 6 layers. I generally tell people to shoot for about 10. It's usually about 2 rolls. Now, it's always going to be a little off on what you need. Rather than do a half distance piece, you just rip it and be done there. We go across, over, and across. Preparation is key when we're making these. So have it prepared, measured, done before you attempt any reduction. Now that we have our length that we need set up, we have a bucket ready to go, and we have extra towels. You're going to take the arm, go ahead and bring it up, and place a stocking net over it. Now, many people don't do this step, especially in the emergency department, because we're busy, we're tired, we're overworked, but it allows you to get a little prettier at the end because you can fold the stockinette down to cover the ends of your splint. You make a small cut, you can have the thumb come out. Then underneath, just as we did before, we're going to do a layer of web roll or fluff, doing that same at least 50% overlap and pulling in the same direction so it stays nice and flat. You want to make sure it's pretty and not bowing up. If you're going to do a really tight reduction, meaning that you're going to have to use a lot of pressure, I generally suggest that you do at least 2 layers over the areas where you're going to be placing pressure. You notice I started there so I would get 2 layers, but I wouldn't be too bulky over the hand. Under. Ideally, you will be setting this up as you are preparing for your reduction. And you want to make sure the plaster never ever touches the skin. Okay? Now that we have that in place, we have our ace bandages ready to go. We have one more pack of web roll. You're going to take your plaster and you're going to dip. So holding on the end securely so it doesn't unfold, you're going to take it, place it in water, not too warm because remember this creates an exothermic reaction which is quite warm in and of itself. So you don't want to burn or make the patient too sweaty or uncomfortable. Take 2 fingers, go down one side, 2 fingers, go down the other. Try not to wring it out. When you wring it out, you'll actually take too much of the plaster out, but you want to get as much of the moisture out as you can without removing too much of the plaster. We're going to bring this up over here, place it, going just to the height of the first MC piece. We have some web roll ready to go right here. You're going to pull that up so you're not touching the thumb. As you notice already, this is a lot messier, a little bit more complicated, but it'll give you a much prettier mold when you're done. Now this layer is optional, but I like to do the layer rather than to put the ace bandage directly on the plaster because it will make it look a little prettier and cleaner at the end. These splints tend to be quite bulky though, okay? Come right here. It's always nice to double glove for that first step. I forgot my own rule. That way you can take that top layer of gloves off. Go through here. The 2-inch I'm doing in opposition to the other one because it gives you kind of a different appearance, and it's nice not having to cut your ace bandage. Like so. There we go. Sorry, I just want it to look pretty. And like so. So same thing, you're going to hold a 3-point reduction. So if it's a Colles fracture that's broken this way with it tilted up, you're going to tilt it back down. The apex would be right here. So you put your fingers on the opposite side and you hold with this amount of pressure. Enough that you're going to leave a little indent of your thumbs in place on it. If you had to do a reduction, you do the reduction and have somebody hold it in position. And if you need to do a reduction, the radius is always short, so having somebody pull up just on these 2 fingers will bring the hand into a tiny bit of ulnar deviation and pull the radius head up as you're holding your mold. And that'll give you a much better reduction and better radial height when you're done, to make sure that your fracture stays within tolerances. Okay. After you're done and you tape this down, you can take your stockinette, fold it down, and then do one more wrap on top to make it look nice and neat. So in comparison to the two, this one is going to be a little bit sloppier in appearance because the orthoglass doesn't mold as clearly to the wrist, but it's not going to be nearly as heavy. It's going to be very fast to put on, where this one's going to be a lot more time consuming to put on, a lot messier to put on, but you can actually get a much prettier alignment and placement with your mold that you should hold for about 3 to 4 minutes before it gets firm, and overall is very nice. The other advantage to orthoglass though is this is actually going to take a little bit of effort to take off. As it dries, you'll have to cut through, where this one you can unwrap, unpeel, and it comes off real quick.
That it?